of women in the United States suffer from some form of sexual dysfunction. This information is from the National Institute of Health, and the numbers may actually be higher considering that a lot of women do not talk to their doctors or providers about this issue, whether due to embarrassment or due to thinking that there's nothing that can be done to really help them. Sexual dysfunction is a term that can encompass a broad range of symptoms, from decreased libido to intense dislike of sex to difficulty having an orgasm to difficulty becoming stimulated in any way, or just a psychological fear of having sex. And the term dysfunction may have a negative connotation for some women because they don't want to think that there's anything abnormal or something that's wrong with them, but it affects so many women that it's very common and it shouldn't be taken lightly in the medical field. Sexual dysfunction can affect women regardless of age, regardless of ethnicity, regardless of socioeconomic status, regardless of sexual preference. So it's something that can affect all women, and there are many causes of this, from physical to psychological. Some of the physical causes including neurological trauma due to surgery, diabetes, menopause, hormone imbalances, fatigue, several other causes, childbirth, and some of the psychological factors can include depression, anxiety, fear due to a history of sexual trauma, or just a miscommunication between partners. So there are several things that can cause this, and it can be mild, it can be moderate, and it can be severe, and it can significantly affect a woman's livelihood and her mental health. So it's very important that we treat this effectively. Due to the commonality of this issue, it's important to have effective treatments, and unfortunately there are not many treatments available for women. Although there are a barrage of treatments for men when they have erectile dysfunction or decreased libido, including a variety of medications, testosterone replacement, and unfortunately there are not as many options for women, and research has primarily focused on psychological factors and treatments that would help with psychological causes. However, there are many physical causes of sexual dysfunction that need to be addressed. The treatments that are available include stress reduction techniques, counseling, sex therapy, exercises such as Kegels. Some women are placed on antidepressants, which can actually make their sexual dysfunction worse. And then there's also hormone replacement therapy, which works for some women, but not for all. Sex is not just an act of pleasure, it's an important aspect of a relationship, and it builds intimacy, it builds families, and so it's a very important aspect of being a human being and having a relationship, and without that it can cause significant stress and significant psychological despair. So again, it's very important to have an effective treatment to help women that have this issue. So what is the solution? Well, since training with the pioneer of the vampire facelift, the O-shot, the priapus shot, Dr. Charles Reynolds, we've implemented a wonderful alternative to treating sexual dysfunction in women with the O-shot. It's a quick 15-minute office procedure. We draw blood first, and the blood is then centrifuged with a special technique that separates out the platelet-rich plasma. And this platelet-rich plasma is then injected with a teeny tiny needle into the clitoris and the anterior vaginal wall, which helps to rejuvenate healthy vaginal tissue. And this in turn can help with increased ability to orgasm, increased ability to become stimulated sexually, increased libido. It can help with vaginal lubrication, tightening of the vaginal introitus, or the opening of the vagina. And as an added benefit, as you'll see in one of my other videos, it does help with stress incontinence and some urge incontinence as well. So it's a great treatment, and it can be used in conjunction with some of the other available treatment options out there. to really, really help women overcome their sexual dysfunction issues. And the treatment is virtually pain-free. We use lidocaine topically as well as injecting it into the clitoris. And just remember, this isn't going to work the same for every single woman, but it's definitely helped a lot of women out there, and many come out of treatment feeling different immediately and often having significant changes within just a few days to a few weeks. So this has been a life-changing experience for many, many patients, and I'm happy to be offering this at my clinic. And if you want more information, you can go to my website listed below. And when you're ready to schedule an appointment, you can call us at 719-428-5310, and we'd be happy to get you in.